Welcome back. The condition can be deadly. Aortic stenosis is when the aortic valve in your heart does not fully open due to a buildup of calcium. So open heart surgery is often the best and most popular option, but now there are some alternatives that are not as invasive. And here to talk about it is Dr. Angel Caldera with Scott & White. Good morning to you.
Good morning, Erin. Thank you for having me.
Thank you for being here. So things are changing.
Yes, so definitely. So it's interesting that once you develop symptoms related to this narrow valve, your chances of dying within the next 2 years approaches 50%. So the procedure to replace the valve is a life-saving procedure, but it does carry some risk. So you're basically trading the risk of your disease by the risk of the procedure. But the technology has evolved in a way that now we have many alternatives that allow patients that did not have an option to undergo a valve replacement.
And one of the alternatives is TAVR. What is that?
So TAVR is when a new valve is implanted in the heart of the patient through the use of catheters. Typically, going from the groin area, we could advance catheters and cross the narrow valve and put a new valve inside. And occasionally, we can go from the tip of the heart with a small incision in the very tip of the heart and implant a new valve inside. The advantages are that you don't have to cut the chest open, and there is not a need for healing of a broken bone, and you don't need cardiopulmonary bypass at the time of the procedure.
So smaller incision, and it's in a different spot.
Well, the access to get into the heart is a different access point, but the valve that we replace, of course, is the same area that we do with open heart surgery. Open heart surgery has also evolved. So in the past, most of the patients will undergo a mid-sternotomy, cutting the middle of the chest. Now some patients could be selected to go through a lateral thoracotomy, a small incision of the side of the chest, which allow a faster healing. So both the traditional surgery and this new technology are opening opportunities to patients that in the past could not be treated.
And you mentioned patients being leery about this. Are there greater risks?
Well, the issue is that you pay a risk when you undergo this procedure, but you have to start with what your risk is to begin with. If you have a 50% chance of dying within the next 2 years, but you can undergo a procedure with a 5% chance of something bad happening to you, but then putting you back to your expected mortality depending upon your other comorbidities, you're probably better off with the procedure. This requires a lot of explanation and understanding in between doctors and patients to know what is the best option.
All right, Dr. Caldera, thank you so much for being here this morning. Some good information about these new procedures out there. We'll have information about it on our website as well, along with this interview at KXAN.com.